Well, you may have noticed that John and Jeff Denoyer are taking part in No Shave November, and their goal is to inspire men to get serious about their health.
And that's right. As part of that push, we are spotlighting prostate cancer this morning. It's the second most common cancer among men, but here in Rhode Island, a brand new robot is changing how it's treated. After being diagnosed with prostate cancer, 53-year-old William Gurton of Burrillville opted for robotic surgery at Miriam Hospital in Providence to remove his prostate.
The unknown of this surgery was the big thing.
Thankfully, he had a friend who'd been through it before.
He filled me in on every aspect of what was going on. That knowledge to me provided the added comfort going into this surgery.
It all went smoothly, and 3 months later, he's doing well.
Recovery was very quick. No issues whatsoever. Yep. I was very happy that I went through with this surgery.
These days, robotic surgery for prostate cancer continues to advance. Miriam now adding a brand new cutting-edge Da Vinci robot.
This current robotic technology will allow them to do their surgery faster and more efficiently because of the way it functions. It can move around in many dimensions, and so the patient doesn't have to get repositioned and moved around, which they had to do with the original robot.
Surgery is minimally invasive, and most patients go home within 24 hours. Despite advances in treatment, what concerns Dr. Guyan Parikh is that many men aren't getting screened in the first place.
Once you get to 55, that you should definitely be screened.
That means a blood test and a rectal exam. You should start younger if you have a family history.
But if it gets beyond the prostate, then you have more and more treatments, and then it becomes very morbid. So we want to prevent that and nip it in the bud sort of thing right off the bat.
And Dorian, many men are reluctant to get treated or even tested for prostate cancer because they're concerned about possible sexual side effects. But there's a lot of misinformation about that stuff out there. They're not as common as you might think. They're not as severe as you might think. And they're pretty easily treatable. Like if you have prostate cancer, that's sort of the least of your concerns. And it's something that you can really address without much of an issue.